Hello, my name is Dr. Henry. In this video, we'll go over the examination of mass in an OSCE exam. So this video will be divided into 3 parts. The first part will be just a brief theory, then the second part, a detailed examination, then the third part, the OSCE. So a mass is any abnormal collection of tissue or fluid or other materials, and then forming a palpable or visible swelling. The term mass can also be used interchangeably with lump or swelling. Okay, masses can occur in any location of the body. In the head and neck, we have lymph nodes. Lymph nodes can become inflamed to form masses, which is the most common when it comes to head and neck. Then we can also have thyroid masses in the anterior aspect of the neck. We also have salivary gland tumors. We can also have lipomas, which is just a lump of fatty tissue that grows under the skin. We can also have what we call sebaceous cysts, which are slow-growing painless masses, which result from blocked hair follicles. So these are the type of masses you can get when it comes to the head and neck. So in the trunk, you can have lipomas as well. You can also have hernias, which include the inguinal and umbilical hernia. You can also have lymphomas. You can also have metastatic deposits around the trunk. So in the limbs, you can have ganglion cysts, which are actually harmless fluid-filled lump near joints or tendons, and that usually occur at the wrist or the hand. So we can also have soft tissue sarcomas, which are cancers that develop from connective tissues like bone, muscles, fat, and cartilage. So we can also have what we call vascular malformations. We also have what we call abscesses in the limbs. So masses can occur anywhere in the body, and knowing the common masses that occur in different locations will also help guide your diagnosis. For instance, if you have a mass in the anterior aspect of the neck, you are thinking of maybe goiter or maybe thyroglossal cysts or so many other things. So knowing the type of masses that occur in different parts of the body will also guide your examination. In the examination of a mass, there are basic characteristics which you must examine for every mass, like the size, the consistency, the mobility, and so many other characteristics which you must examine for every mass. Now, there are some specific locations where if a mass occurs, you have to go ahead to check other signs. For instance, if you have an anterior neck mass, which you might suspect to be goiter, you have to check some other places which goiter might affect, which includes maybe the eyes for the eye signs. You also have to check the upper limb and the lower limb. So you have to check these things because this is a special place, a special location where a mass has occurred. But for every other mass, there are basic characteristics which you must examine. So this video, we are going to go over those basic characteristics. Then in the next video, we'll try to go over so many other special masses like anterior neck mass or maybe masses in the trunk where you're suspecting hernia. So this video will just be on basic examination of every mass, maybe masses in the upper limb, the head and neck, other locations that are not so special. But if you have these special locations, you have to know the special examinations which you have to undergo apart from this basic mass examination. So this video will just be on the basic mass examination. So like I said, we'll create separate videos for those special examinations. For here, we'll focus on the general examination of a mass. Now, like I said, when you're examining a mass, there are key characteristics which will guide your diagnosis. Okay, you must know the anatomical sites of the mass, which will help you predict the likely pathology. Then again, you must also know the size of the mass. Generally, larger masses, which are greater than 5 cm, are more concerning. Then you will also check some other symptoms, which might include things like pain. If there is pain, it might suggest inflammation. If it is painless, that might suggest neoplasm. You also check the consistency, whether the mass is cystic, which is fluid, or whether the mass is solid, which is just a tissue. You also check the mobility of the mass. So after mobility, you also check the skin involvement and so many other characteristics which are going to check for the basic examination of the mass. So we're going to go over that in the detailed examination. Now, just for you to note, before we head over to the examination itself, the top 5 benign masses which might occur are things like lipoma. Okay, lipoma is just a growth of fatty tissue under the skin and it's always soft, mobile, and then the sleeping sign will be positive. We're going to demonstrate the sleeping sign during the detailed examination. We also have what we call the sebaceous cyst. That is the second most common benign mass. Then we also have the lymph node, maybe an inflamed lymph node. So we also have what we call the ganglion cyst. You can also have abscesses, which will be hot and tender because of inflammation. So these are the most common benign masses which you should know about. Then again, some of the red flags which might indicate malignancy, which during examination, which you'll notice, if your mass is very hard, then that means it's a red flag for malignancy. And then if it is fixed to deep structures, it's also a red flag for malignancy. If it has irregular surfaces, that is also a red flag for malignancy. Now we're going to go into the detailed examination of the mass. Now, like I said, in every examination we have the pre-exam where you're going to introduce yourself to the patient, seek consent of the patient, then perform your hand hygiene, properly position and expose your patient. Okay, then prepare your equipment. That is the pre-exam. Then in the post-exam, you thank your patient and then summarize your findings. So the pre-exam and the post-exam is always constant for every exam you perform. Now, the examination itself, when it comes to examination of masses, we use the 4 techniques which we normally use for examination, which include inspection, palpation, percussion, and auscultation. Now, under inspection, we are going to, first of all, start by inspecting the patient, looking at the patient generally to note the patient's general condition. Then we'll go over to inspect the mass locally. First of all, under inspection, we are going to look at the site, where we are going to note the anatomical location of the mass. Then we also look at the number, whether the mass is just single or multiple. We're also going to look at the size. So we'll try to visually estimate the size. We're also going to look at the shape of the mass. So the shape can be spherical, ovoid, irregular. Then we're also going to look at the surface characteristics. All this you would note during inspection, the surface characteristics of the mass. You also look at the overlying skin. Then also try to note the vascular features, whether there is increased blood flow to the area of the mass. So these are the things you must note on inspection. Then on palpation, you are going to start by noting the local or the differential warmth or the local temperature of the mass by comparing it with a normal location. Then you also check the tenderness of the mass. You're also going to use a tape to measure the size of the mass in at least 2 dimensions. If the mass is too large, you can also measure the 3rd dimension, which is the height. So you must note the size of the mass with a tape in 2 dimensions. Then you're also going to use your hand to feel the surface texture of the mass. Then try to feel the edge of the mass. Then you're also going to note the consistency of the mass. So the consistency of the mass can either be hard, firm, or soft. We always note it with this. Your earlobe is soft, your nose is firm, then your forehead is hard. Okay, so you note the consistency of the mass. Then when you are done with all this palpation, then you're going to perform what we call fixation tests, where you try to pinch the skin over the mass to see if the mass is attached to the skin. Then if it's not attached to the skin, then you perform what we call mobility assessment. You try to move the mass in different directions to see if it can move. Then now perform what we call the deep fixation test, where you will try to contract the muscle on which the mass is on. Then try to move the mass again to know if it is still mobile. This will help you note whether the mass is fixed to the underlying muscle. When we are done with the fixation test, then we're also going to check what we call fluctuation test to see if there is fluid in the mass. Then we're also going to do what we call transillumination. Now, if the mass is very large enough, like in the abdomen, you can do fluid trail for the fluid tests. So when you're done with all this palpation, you're also going to check the lymph nodes, which drains the mass. For instance, if the mass is in the anterior neck mass, you are going to check the cervical group of lymph nodes. If the mass occurs in the upper limb, you're going to check the axillary group of lymph nodes in that limb. So check the node that drains the mass which you're examining. Then you can also check the peripheral pulses if you suspect maybe blood vessel involvement. Then percussion will depend on the mass. But most times, in most masses, you might not need to percuss. But in some masses, you might need to percuss maybe to note the extent of the mass. Then you can also auscultate if you suspect blood vessel involvement for what we call bruit or venous hum. So these are the basic things which must be performed for every mass which you assess. Now we're going to demonstrate it physically here with an improvised mass. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also share this with your friend who might need it. Now we are going to go into the examination proper. So like I said, in every examination you ever perform in an OSCE scenario, start by performing what we have the 3 phases: the pre-exam, the examination itself, and then the post-exam. So in the pre-exam, we're going to greet our patient, take permission from the patient, then properly expose and position the patient, perform our hand hygiene. So that's for the pre-exam. In the post-exam, you thank your patient and then summarize your findings. So we're going to go ahead to start with our pre-exam now. Hello, good afternoon. Good afternoon. My name is Dr. Henry, and I would like to examine the lump you have in your hand. Can I go ahead? All right. All right. So the next is to perform a hand hygiene. Okay, so you are supposed to properly position and expose your patient. Now, this mass is located over the dorsum of the wrist, and you know that the dorsum of the wrist will drain into the axillary lymph node. So ordinarily, you should have told your patient in an OSCE scenario to remove their shirt, because you know that at the end, you definitely have to examine the axillary lymph node during the examination of the mass. Okay, so that is properly exposing your patient. The first technique we're going to use is inspection. Okay, we're going to start with inspection. And like I said, you are going to inspect the patient generally. Just look at the patient generally first to note the overall health of the patient. Okay, so like I said, the first thing you're going to note when examining this mass is the site, the anatomical site of the mass. Okay, so this mass is located at the dorsum of the left wrist. Okay, so you have to be very, very specific when describing the mass. So this is a mass located over the dorsum of the left wrist. After the site, so the next thing you're going to note is the number of masses. So the mass can be single or it can be multiple. So this is a single isolated mass located over the dorsum of the left wrist. So it's a single mass. So we've noted the size, we've noted the site and the number. The next is visually try to estimate the size of the mass. But during palpation, we're going to use a tape to measure the mass. So just try to visually appreciate the size of the mass. You don't have to document, just visually try to estimate the size of the mass. Okay, then the next aspect is the shape. We are going to describe the configuration or the shape of the mass. So our improvised mass is spherical and well-rounded. So in documentation, you can say this is a spherical, well-rounded mass located over the dorsum of the left wrist. So we've incorporated everything we examined up to this point. Then again, you look at it, try to observe the surface characteristics, whether the mass appears smooth or whether the mass appears nodular or have projections. So just look at the mass to know if the mass appears smooth. During palpation, we are still going to palpate the surface texture, but try to visually appreciate if the mass is smooth or whether there are projections or if the surface shows visible pulsations. Okay, so you're also trying to look at the mass to know if there's any visible pulsation, which will denote involvement of a blood vessel. Okay, so try to carefully look at the mass for the surface texture, which will include whether the mass is smooth and regular, whether the mass is nodular, whether there are projections from the mass, whether the mass pulsates, which will mean involvement of a blood vessel. Okay, so when you are done examining the mass like that, the next thing you're going to look out for during inspection is the overlying skin. You're trying to note if the overlying skin appears normal in color and texture. So you're also going to note if the skin is erythematous and shiny, which might suggest inflammation, or if there is a central puncture visible, which is characteristic of sebaceous cysts, or if the skin shows pure derange appearance, which indicates lymphatic obstruction, or if the overlying skin is ulcerated, or if there is multiple dilated veins over the surface. So just try to look at the overlying skin and note all these changes. Or there might be hyperpigmentation. So look at the overlying skin to know if the skin is normal in color and texture, or if there's a change in the skin when compared to the surrounding skin. Then you note your findings. Or then when you're done with that, the next feature we're going to look at is vascular features. So in some masses, you might have what prominent dilated veins occurring over the mass. You might also have visible pulsations noted, which is synchronous with radial pulse. So these are things you must try to note if there's vascular involvement of the mass or if there is no abnormal vascular involvement visible. You note that too. So these are the 7 features which you must quickly note. During OSCE scenarios, you won't need to be looking at it, be like, this is, I've noted the site, I've noted the number. No, just look at the mass and try to appreciate. So if you have all these things already in your head, try to look at the mass and appreciate these characteristics of the mass. You can do this within 5 seconds during an OSCE scenario, so that it won't take your time. Okay, but for the sake of the video, we are trying to explain it one after the other. But during your OSCE scenarios, you don't need to start looking at the mass. Okay, I can know the site, I can know the number, I can know the shape. No, you do it once, just look at the mass, then try to note all the characteristics which we've listed above. When you're done with inspection, the next is palpation. So like I said, the first thing we're going to check on palpation is the local temperature, or what we call differential warmth of the mass. So where you try to compare the temperature over the mass with temperature over a normal area, over a normal location. So for this mass, sir, please can you bring your hand close together? So we're going to compare the temperature over the mass with the temperature over the other dorsum of the wrist. So you go from normal, then check abnormal, then check the normal. Okay, so you check the normal temperature, then check over the mass, then check over the normal area again. Okay, try to note if there's any difference in the temperature of the both areas. Okay, so and you're going to do that with maybe the dorsum of your fingers. You can try to do that with dorsum of your fingers. If the mass is large enough, you can use the dorsum of your 4 fingers, but if the mass is very little, you can use the dorsum of 2 fingers. Okay, so on the normal area, then over the mass, then on the normal area. So you're trying to note if there's any differential warmth. So the sample documentation is that the temperature of the mass is normal, similar to surrounding areas. Or if it is abnormal, you can have something like that. The mass is noticeably warm when compared to other tissues, suggesting inflammation. Or the mass might feel cold to touch, which is concerning for vascular compromise. So these are things you might note during the examination of the mass. The mass can be normal, it can feel cold, or it can feel warm to touch compared to other parts of the body. So if it is normal, then that's okay. But if it is warm, or if it feels warm to touch, or noticeably warm to touch, it might suggest inflammation. If it feels cold, it might indicate that there's a vascular compromise. Now, when we are done with the temperature, the next thing you're going to check is the tenderness over the mass. So you will start by asking the patient, is this painful? Okay, then you are going to gently palpate the mass while looking at the patient's face, okay, to note if there's tenderness. So you gently palpate the mass while looking at the patient's face to note if there's any tenderness. Now, if the mass is big enough, you can palpate in multiple areas. Then while looking at the patient's face to note if there's any tenderness on the mass. If the mass is tender, then you try to note the area where the mass is tender. For instance, the mass might be tender centrally, but not tender at the periphery. Then you also try to grade the tenderness based on the reaction of the patient where you are palpating the mass. So when you are done with the tenderness, the next one you're going to check is the size where you are going to accurately measure the size of the mass using your tape. So you're going to measure in 2 dimensions at least. So for this mass, you're going to measure. So this mass measures 4 cm by 2 cm for the height, for the length and the width. Now, if the mass is big enough, you also have to measure the height, which is 3 dimensions. So, but for this mass, we're going to measure 2 dimensions, which is 4 by 2 cm. Now, when you're done with the measurements, the next thing you're going to check is the surface. You're going to palpate to note the surface texture, to know if the surface feels smooth and regular throughout, or if it is lobulated, or if it is nodular, there are nodules, or if it is rough. So just try to palpate over the surface of the mass to know how it feels or to know the surface texture. So in checking the surface texture, so you try to go in a circular motion to feel the mass, know the texture, whether it is rough, lobulated, nodular. Okay, so you feel over the entire mass. Okay. When you're done checking the surface texture, noting if it is rough, smooth, or if it is nodular, then you check the margins. Try to note the margins. Go around the mass. Note if the edges are well defined and clearly demarcated from the normal tissue, or if it is ill defined and merging with the tissue. Okay. So try to note the edge or the margin of the mass. When you're checking for the margin, if the swelling is slipping out, it is slipping sign, and most times happens in lipoma, and might suggest that the swelling is a lipoma. Then when you're done checking the margins, the next thing you're going to check is the consistency. Press down the mass, okay, to note the consistency, how hard or how soft it is. If it feels like your earlobe, it is soft. If it feels like the tip of your nose, it is firm. If it feels like your forehead, then it is hard. Okay, so you feel this. So this mass feels firm. So improvised mass feels firm. Okay, so like we said, your earlobe, if it is very soft, then it might suggest lipoma. So when you are done checking the consistency, the next set of tests we're going to perform are what we call the fixation tests, where we are going to check 3 things. First, we're going to check if the mass is attached to the overlying skin. Okay. Then we're going to check if the mass is mobile on its own. Then we're going to put the muscle under it, under tension, to see if the mass is attached to underlying muscle. Okay, so 3 tests. We're going to do the skin fixation test, the mobility test to see if the mass is mobile. Then we'll now put the muscle under the mass, under tension, to know. So if the mass is mobile ordinarily, then when you put the muscle under tension, the mass ceases to be mobile. It means that the mass is attached to the muscle or the tendons of the muscle. So that's what we're going to do now. So for the skin fixation test, you're going to start by pinching the skin over the mass. So when you try to pick the skin over the mass, if the skin is freely mobile over the mass, that means there's no skin involvement. But if the skin is fixed to the underlying mass, that means it cannot be separated. That means the skin is tethered to the mass. You note that. Okay, so for this, our mass, and improvised mass, we can say that the skin freely moves over the mass, so there's no skin involvement. Then when you're done with that, then you try to move the mass to know if the mass will move freely in all directions, okay? So try to move the mass up and down, left to right, diagonally, okay? When you're done with that, so this mass is freely mobile, okay? Now when you're done with that, you now put the muscle under the mass, under tension, okay? When you put it under tension, you try to move the mass again. So if the mobility of the mass is reduced when the muscle is under tension, it means that the mass is attached to the muscle. So the muscle under the area of our improvised mass naturally should be able to extend the wrist. Okay, so we'll put the muscle under the mass under tension. Okay, so we're going to apply resistance here. Okay, try to raise up your hand. Okay, against resistance. So he will try to raise up both his hand. Okay. Okay, raise your hand up. Okay, so try to raise up your hand against mine on resistance. Okay, so with this, the muscle here have been put under tension. Then you still try the movements in all directions. Okay, if the mass is attached to the underlying muscle, when you put this under tension, okay, tense it up again. When you put it under tension, the mobility will be reduced. But if it's not attached, Despite putting the muscle under tension, the mobility will still not be reduced. That's how you check if the mass is fixed to deep structures, okay, and completely immobile. So the next step of palpation, we are trying to know the contents of the mass. We've noted the texture, we've noted the fixation, the mobility, and a lot of other things. So we want to know the contents of the mass. So one of the tests we're going to perform now is what we call the fluctuation test, where we'll try to note if the mass contains fluid, okay? So in the fluctuation test, place 2 fingers at the edges of the mass. Okay, use this to depress the mass. So if the mass contains fluid, it will move this hand outwards as you are depressing it. But if it is solid, if you depress it, it will not affect the fingers you placed at the edges of the mass, okay? So you press 2 fingers along the edge of the mass, then use 1 finger to depress. We'll call it the fluctuation test. So if the mass contains fluid, it will displace this. As you are depressing this, it will displace the fingers. But if it doesn't contain fluid, as you are depressing it, it won't displace the fingers. Okay, let's try it now. Then again, what you notice that when you try it in this plane, okay, you also try it in another plane, okay, so that you will be sure of your result. Okay, so we are going to try it in this plane now. So place this finger, I think this is called watching fingers. So you place your fingers like this along the edge of the mass, then you depress. Maybe try it 1 or 2 times to depress. Okay, it's not displacing, so you press it along another plane, press it along this plane, and still try to depress. Okay, so this is what we call the fluctuation test. And a positive fluctuation test is when there is displacement both in the horizontal and the vertical planes, which will confirm that the content of the mass is actually fluid. But if there's no fluctuation detected, it suggests that the mass is solid. The next test is what we call Transillumination Test, which will also help us determine the content of the mass. Now, what we do in Transillumination is you're trying to shine a light source, something like your pen torch, through the mass and observe it through the other side, okay? So if the mass contains fluid and the fluid is clear, it will be able to brilliantly transilluminate the light to the other side. You see it clear from the other side. So that is brilliant transillumination. It shows that the mass contains fluid and the fluid is clear, which is consistent with what we call cysts or hydrocele. Now, if there is no transillumination at all, it means that the mass is solid. It doesn't contain fluid, because the solid mass will not transilluminate light. Then if it is partial, just partial, that means but the fluid is turbid or the fluid is not clear. Like we said, to perform a transillumination, you're going to need a light source such as our pen torch, then a piece of paper folded into a funnel. Okay, so we're going to press the light source firmly over the other side of the mass, making sure that the light doesn't escape through the sides. Then we'll place our paper, our funnel, on the other side of the mass and try to observe, see if the light can transilluminate. And like we said earlier, if it contains fluid, the light will transilluminate. You'll be able to see it through this side. If it's a solid, it will not transilluminate. Okay, so you first of all start by pressing the light source firmly on the other side of the mass, making sure on the other side of the mass, making sure that the light doesn't escape from the sides. The light goes straight into the mass. It doesn't escape from the sides. Okay, then you use this, maybe a funnel or anything other thing, and look into the funnel to see if the light transilluminates. Okay, so this is solid, so there's no transillumination. If you have to be a fluid-filled mass, when you press the light here, okay, observe it through this end, you will still see the light transilluminate through the mass. Now, this ordinarily should be performed in a dark room. Okay, in a dark room, you might not need the paper. With just a pen torch, you'll be able to perform transillumination without the paper. So when you're done with transillumination, it means you are done with examining the mass itself. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also, share this with your friend who might need it. Now, you're going to do what we call regional examination around the mass. So the first thing you're going to do is that you're going to check the group of lymph nodes which the mass drains into. Okay, so for this mass, it should drain into the left axillary group of lymph nodes. So that means you have to examine the axillary group of lymph nodes, the left axillary group of lymph nodes. So please, can you hold my hand? Okay. Okay, so when the patient holds your hand, you examine the axillary group of lymph nodes. Okay. If you want to learn how to examine the axillary group of lymph nodes, you can watch our video on physical examination, general physical examination. So you examine all the groups of axillary group of lymph nodes. Okay. When you're done, you also examine the lateral. Okay. So examining the side of which the mass occurs can suffice, but you can also go ahead to examine the other side. Okay. If you have time during your OSCE exams, you can also go ahead to examine. When you're done checking the lymph nodes, then you also check the pores around the area of the mass. Okay, and also compare it with the other pores of the other side to see if it is intact and equal bilaterally. Okay, so you check the pores on the side of the mass. So in this case, we check the radial pores on the side of the mass. Okay, so where you are not trying to note if it is intact and equal. Then when you're done checking the pores this side, then also check the pores in the other arm bilaterally. Okay, so in checking the pulse, you're trying to note if it is equal bilaterally. Okay, check the peripheral pulse of the affected arm, then check the peripheral pulse of the other limb, okay, to note if it is equal. Now, if the swelling is in the lower limb, check the pulse closest to the swelling. You can check the dorsalis pedis pulse, you can check any pulse around the mass. Then we are done checking the peripheral pulses, also going to perform a little assessment of the joints after the mass and the joints before the mass. Okay, sir, can you please raise your hand? Okay, can you move your wrist up and down? Okay, sideways. Okay, can you move your fingers? Okay, then can you move your elbow up and down? So you are just trying to check the joints before and after the mass to see if the movement is still intact in all of them. So when you are done with this, it means you are done with the examination of the mass. So you thank your patient, then cover your patient appropriately, and maybe summarize your findings. Okay, so thank you for allowing me to examine you. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also, share this with your friend who might need it. Hello, good afternoon. Good afternoon. My name is Dr. Henry. I would like to examine the lump you have on your hand. Can I go ahead? Can I see your... Okay. Do you feel any pain? So can you try to squeeze your hand? Okay. Raise it against my hand. Okay, can you move your wrists up and down? Okay, move it this way. Okay, move your fingers like this. Okay, can you do your hand like this? Okay. Okay, so thank you for allowing me to examine you.